Welcome to our video about fungal infection in the stomach. While no systematic study has been performed to date, recent cases of intra-abdominal fungal infections have increased in frequency. While most clinical experience is based on case reports or uncontrolled case series, the fact remains that these infections are often severe and associated with significant morbidity. Early recognition and treatment are critical for improved patient outcomes. Treatment often includes surgery. Surgical intervention may be necessary in severe cases. This video will discuss the causes of this condition and possible treatment options. Candida causes gastric mucormycosis. There are several different clinical syndromes related to Candida, including gastric mucormycosis. This disease is rare and typically acquired through food or an implanted device. The most common site of infection is the stomach, but it can also occur in the colon and esophagus. There is a high rate of mortality associated with GI mucormycosis, which presents with nonspecific symptoms and fever. Although the cause of gastrointestinal mucormycosis is unknown, the symptoms can be nonspecific and include abdominal pain, a mass in the abdomen, necrotizing enterocolitis, fever, and typhlitis. The infection may also involve the liver and spleen, which can result in severe complications such as peritonitis, hemorrhage, and necrosis. The patient underwent a repeat gastroscopy, which revealed a plaque-like mass lesion in the stomach. Histology of the mass revealed a mixture of fungal organisms, inflammatory debris, and broad hyphae without septi. Treatment with amphotericin B improved the patient's condition, and he no longer required hemodialysis or inotropic support. However, during the course of his treatment, the patient experienced a new septic episode. He had developed refractory septic shock. Mucormycosis is rare and largely diagnosed in immunocompromised individuals. The symptoms vary from person to person but include abdominal pain, nausea, vomiting, and distension. In severe cases, the symptoms may even lead to an intra-abscess. Diagnostic tests include a biopsy of the suspected area during surgery or endoscopy. Ultimately, it is not possible to diagnose the exact species of fungi, however. A number of risk factors are also associated with the development of mucormycosis. People with burns, malignancies, or a splenectomy have an increased risk. People who are exposed to toxic chemicals in an environmental disaster also have a higher risk. Mucormycosis symptoms are consistent with a fungal infection, but some people may have symptoms in more than one area of the body. Regardless of the type of gastrointestinal mucormycosis, treatment is important. Mucormycosis has an invasive nature, requiring immediate medical management. Early diagnosis is critical to reducing mortality. If the condition is not recognized early, surgical resection may be necessary. If a patient fails medical treatment, the symptoms may deteriorate. Once identified, treatment should be tailored to the individual patient's specific needs. Candida overgrowth causes leaky gut. A high-stress lifestyle may be a contributing factor to the development of Candida overgrowth, a bacterial overgrowth of the gut. Candida overgrowth damages the intestinal wall, causing a leaky gut, which subsequently releases toxic byproducts into the bloodstream. A leaky gut can worsen symptoms of autoimmunity and thyroid dysfunction. Here's what you should do if you suspect that you're experiencing a leaky gut. UTIs are accompanied by symptoms such as burning during urination, cloudy or strange-smelling urine, and a recurrent urge to urinate. Candida overgrowth can also be the cause of recurring infections. Urine tests will reveal whether the problem is caused by the overgrowth of Candida, or a different cause. Healthy gut flora help with digestion. The presence of both good and bad bacteria is essential for your overall health. A diet free of processed foods and sugars may help you overcome the overgrowth of Candida. The American Academy of Allergy, Asthma, and Immunology, AAAI, considers this syndrome unproven, and states that there is no proven cure. Regardless of the causes, however, you should consult with your doctor if your symptoms persist or worsen over time. It's best to rule out serious conditions before deciding on a Candida diet. When your intestines become overly swollen and inflamed, Candida overgrowth can lead to a variety of symptoms. Most people with leaky gut don't realize it, but studies have shown that this condition can be caused by an overgrowth of Candida albicans. The problem occurs when the fungus, which is also a type of yeast, gets out of control and outnumbers healthy bacteria in the body. If you're taking antibiotics regularly, you're putting yourself at risk for a leaky gut. A recent study has shown that an overgrowth of Candida is linked to an increased risk of developing autoimmune diseases, such as lupus, diabetes, and thyroid disease. Although a definitive cause for autoimmune disease is still unknown, more research is needed. If you're suffering from one of these symptoms, consider taking steps to treat the overgrowth of Candida and autoimmune disease. While there are many benefits to treating Candida overgrowth, you should always consult your doctor first. Candida causes thyroid dysfunction. In many people, a Candida infection in the stomach contributes to thyroid dysfunction and may even be the cause. As a result of this infection, Candida albicans transforms from a round yeast form into elongated hyphae and penetrates the intestinal barrier. This permeability allows toxins and partially digested food molecules into the bloodstream. In addition, leaky gut often contributes to food sensitivities and the progression of autoimmune disease. It has been found that people with weak immune systems are much more susceptible to Candida overgrowth. This is because their immune systems are compromised due to poor diets full of sugar and processed foods. They also suffer from low amounts of clean protein and healthy fats. Environmental toxins, such as smoke, alcohol, and a sedentary lifestyle, are also known to weaken the immune system. This imbalance in the digestive system can lead to an array of uncomfortable symptoms, including thyroid dysfunction. The microbiota in the stomach plays a role in the regulation of the metabolism of iodine, estrogen, and dopamine. It is also known to affect the metabolism of L-thyroxine and the action of antacids such as propylthiouracil. However, the exact role of the microbiota in thyroid disease remains unclear. Nevertheless, it is important to consider the role of the microbiota when considering treatment for thyroid dysfunction. Although the composition of the microbiota of pregnant women and patients with metabolic syndrome is similar, the exact mechanism by which the two sex groups differ is unknown. However, it is thought that there is a connection between obesity and thyroid disease. The increased number of enterocytes and bacterial overgrowth in hypothyroidism may be related to the microbiota's alteration. In addition, a higher number of Prevotella and bacteroidetes may be responsible for the increased production of iodothyronines. Research has found a relationship between Candida and autoimmune thyroid disease. The Candida infection triggers the production of cytokines by Th17 cells, which are responsible for inflammation in the body. The toxins that they release can also trigger the immune system to overreact, attacking the body and its own organs. This imbalance leads to an overactive immune system that targets the thyroid gland. However, this doesn't mean that a Candida infection is the cause of thyroid disease. Candida causes esophageal candidiasis. The esophagus is the second most common site of infection by the fungus Candida, after the oropharynx. The disease is most common among immunocompromised people and patients with esophageal motility disorders. In most cases, patients with FA have no other symptoms, including a painful or sore throat, indigestion, and weight loss. However, symptoms can mimic other esophageal diseases. Diagnostic testing for esophageal candidiasis depends on a combination of laboratory and endoscopic procedures. Symptoms of esophageal candidiasis include difficulty swallowing, pain, and a feeling of being stuck in the throat. Infants may also experience problems with feeding or pass the infection to their mothers during breastfeeding. The infection can also cause severe pain and discomfort. If left untreated, esophageal candidiasis can lead to serious complications, including cancer and HIV/AIDS. Among people living with HIV, Candida causes esophageal candidiasis. Infectious esophagitis is the most common cause of esophageal ulceration. About 88% of esophageal candidiasis cases are caused by Candida albicans. 10% of patients also have a herpes simplex virus or cytomegalovirus infection. Symptoms of esophageal candidiasis can vary depending on the patient's severity. If the condition is suspected to be due to a complication such as HIV infection, treatment with oral antifungals is the first step. Systemic antifungals can improve the immune status and increase the chances of successful treatment. Patients who become pregnant during treatment should stop taking these medications if they become pregnant. However, it is important to monitor CD4 levels carefully to avoid the adverse effects of antifungal medications. In most cases, treatment for esophageal candidiasis involves taking an oral antifungal drug, such as fluconazole. If symptoms do not improve after fluconazole therapy, further investigation may be needed. A physician can also order a blood test to determine the cause of the infection. Although the use of fluconazole antifungals is generally safe and effective, some patients experience unpleasant side effects during treatment. Patients should be sure to brush and floss regularly and consult a dentist regularly. People with diabetes, dentures, or other dental problems should also see a dentist to ensure that the bacteria in the mouth are properly balanced. To avoid the onset of esophageal candidiasis, people should reduce or quit sugar-containing foods and tobacco. However, if these measures are not sufficient, a doctor may prescribe an oral antifungal medication. Thanks for watching. Please like, comment, and subscribe if this was helpful.